Okay, so we had several groups come together because we were sort of talking along the same lines. So healthcare, supply and demand, and holistic preparedness. We all got together. And the key issue that we elected to solve was the lack of preparedness and coordination in responding to Ebola. So we went very specific on that. We have several value propositions to our solution. So, we were really looking to bring forward a more proactive response, a more efficient response that really drives faster recovery, and that really looks to what we were calling building forward better. So not just the immediate response and the immediate needs for Ebola, but really how do we build and rebuild health systems stronger. And we wanted to develop a model that would apply to other disasters as well. So something we could test now that we would be able to use in natural disasters or other pandemics or epidemics in the future. Our key activities, the way that we're going to do this, we would like to develop and use a marketplace to share needs and resources. And we really talked a lot about the fact that there are marketplaces out there and what some of the pros and cons of them were. And where we really had some good discussion was around the fact that, one, we have to use the marketplace, so there needs to be some behavior change mechanism where we all really agree to get together and use it, and that the marketplace has to allow for both a sort of virtual and offline relationships, so that people coming to use this would sort of come with the understanding that this is about finding identifying needs or identifying resources that you have, but coming to it with the understanding that you're going to find a partner that you can work together with with a longer time frame. So not just we will ship this shipment of medical supplies today, but what are your logistics and shipping and delivery and supply chain needs in the long term. So that's one of our key activities. The other one is obviously to sort of do a needs assessment, be able to define what the needs are right now in Ebola, and then how do we convene the key players to bring those plans together. Our targeted populations, or actually I'll start with our key players. Our key players are the government, sort of writ large, but also trying to figure out who the specific ministries are in the countries that we're working in around Ebola to define that. Obviously, corporations, private sector, nonprofit sector, international, multilateral organizations. This room, looking at all of you, because it's a phenomenal idea and you're all going to adopt it. And then the targeted populations, really in the long term, the people that we're looking to help. Obviously, the people of the countries in Liberia, Sierra Leone, Guinea, possibly the surrounding countries that are also, at risk, and then the frontline healthcare workers, and ultimately the people who are either suffering from Ebola currently or most at risk. So that is our pitch.
Beautiful. Give her a big round.